My name is Estefania Ramirez. I am going to talk about organ hair and lung transplant from HCV-infected donors to infected recipients. Definition: the advent of direct-acting antiviral agents to treat hepatitis C virus infection has raised the possibility of substantially increasing the donor organ pool and enable the transplantation of heart and lungs from HCV-infected donors into recipients who don't have HCV-infected.
Each year, there are about 1,900 lung transplants performed in the United States, but there's also 2,600 people added to the waiting list. There aren't enough lungs to go around for everyone who needs them. In my own experience, I know that my patients who are shorter tend to wait longer for a lung transplant. That seemed to be very much related to the fact that we try to match up donors and recipients based on how big the lungs are. Can't put a really big lung in a small chest, can't put a small lung in a big chest. Yet, before this, no one had quantified these differences. So we used a nationwide sample of 13,000 adults on a waiting list for lung transplantation. And what we found is that shorter adults do indeed experience a lower rate of transplantation. Adults under about 5'3" or 5'4" have a 30% reduced rate of transplantation and about a 60% increased risk of dying or being removed from the waiting list because they've simply become too ill without a transplant. It wasn't just an extreme effect observed among very short adults. This effect of being shorter existed across the spectrum of normal heights. For every 5 centimeters shorter someone was, the likelihood of transplant went down by 8% and the risk of death went up by 12%. These findings are important because I think they're going to inform how transplant centers match up donors and recipients, hopefully accepting tall donor lungs for shorter recipients and getting them transplanted faster. And I also hope that it would influence health policymakers, perhaps by changing the allocation system and giving our shorter adults a better chance at transplantation.
Application in medicine. A trial involving the transplantation of heart and lung from donors who has hepatitis C viremia of the HCV genotype to adults without HCV infection. A direct-acting antiviral is prevented to organ recipient 4 weeks starting a few hours after transplantation to block viral replication. The primary outcome has combination of the sustained virological response 12 weeks after completion antiviral therapy for HCV infection and survival of the infection that 6 months after transplantation.
Our goal always had been to provide every aspect of heart and lung surgery to the people of West Michigan so that no one would ever have to leave Grand Rapids or West Michigan to get that kind of care. And so the support of Rich DeVos and the DeVos family was an enormous gift and benefit to us because it meant that we could bring that gift of heart transplantation and lung transplantation to West Michigan.
And it's just a wonderful feeling. It's just like, like you got a really bad cold and all of a sudden you're feeling good and you go, wow, it feels good to feel good.
So we did 100 lungs, 100 hearts. Not many programs can achieve that in such a short period of time. And the next step will be, we're already very well known within the state and even outside the state. The next step is to be known nationally, be a national major player.
And taking into account the calculated risk for individual patients, our outcomes are amongst the best in the country.
We've gotten actually a reputation for willing to take on high-risk patients that other institutions would consider a prohibitive risk. So we've transplanted many patients that have been turned down from programs in the east side of the state. So we actually are getting referrals from the southeastern Michigan pretty routinely. And we've started to get referrals from outside the state.
when you are able to utilize the amazing gift of a donated organ and make somebody's world better and make it that they can return to a much more normal lifestyle and enjoy a much better quality of life, it's extremely rewarding to be part of that.
I just want to get back into running and just get back into living.
Diagnostic test. The development of potent direct-acting antiviral agent to treat HCV infection has provided opportunity to try infection a patient who has gone through organ transplantation, while the use of organ from infected donors has been controversial. It is necessary to carry out tests antiviral antagonists HCV, the surface antigen of hepatitis B virus, cross prevent the transmission of the HCV infection. HCV treatment improve patient survival. Counts. No serious adverse effects related to the treatment observed until a few years ago. Organ transplantation from donors with HCV caused chronic infection, and most recipients HCV treatment is highly effective, safe, and with a prophylaxis interaction compatible with immunosuppressive drugs.
My name's Chaz Devlin. I had a heart double lung transplant in 2003. It's rare. There's only about 30 of these transplants done a year in the U.S. Because it's basically 3 organs. I have a 3-organ transplant. I have 2 lungs and a heart. So I'm thrice blessed, and it's an amazing thing. I was diagnosed with cardiomyopathy at age 16 when I went for a physical for my driver's license. I had no clue that there was any problem. Over the years, my heart was getting weaker and my lungs were getting worse. It was very difficult to do things. I couldn't work. Even I was on oxygen 24/7. Pre-transplant pen was fantastic. Quality of care was great. All the medications and changes and things that they did for me to help improve my quality of life while waiting was phenomenal. And post-transplant, same. I mean, it was fantastic. Both heart and lung transplant teams did a phenomenal job of getting me back on my feet and getting me rolling. I measure my time post-transplant mostly in milestones. I've been to a number of high school graduations that I may not have been to. I've been to all my kids' college graduations, been to my son's marriage, and now have a grandchild that I saw born. So life is fantastic. And if you're blessed enough to get a transplant, then thank God and thank your donor and his family and go out and live your life. I mean, that's what it's all about. It's that second chances and living life.
Conclusion. In patients without HCV infection who receive a hair alone transplant from donors without hepatitis C viremia treatment with antiviral regimen for weeks. A few hours after transplantation prevent to involvement of HCV infection. Thank you.